Hello and warm regards to all the viewers. I am Dr. Shalin Shah. I am a consultant endocrinologist at Gujarat Diabetes and Endocrine Foundation at Ahmedabad. At the outset, I would like to heartily welcome all the viewers to this Endocrine Society of India Facebook Live session. I would also like to thank the Endocrine Society of India and all its office bearers for entrusting me with this responsibility to moderate this endocrine awareness session. The Endocrine Society of India is the largest professional body of endocrinologists, and the society carries out these awareness sessions to help the general public understand different endocrine disorders. These Facebook Live sessions are usually carried out and aired every Saturday of the month, and each month has its own theme, and the theme for October is bone health. And the topic for discussion today is vitamin D deficiency. Do we really need to worry? So we are all aware that vitamin D is a widely studied and routinely used molecule in clinical practice. But the understanding and importance of this molecule still leaves a lot to be desired. From a technical standpoint itself, vitamin D is basically a misnomer, and it is more accurate to view it as a hormone. So to unravel this enigma of vitamin D, we have with us a group of esteemed endocrinologists, and I would now like to introduce the esteemed panelists. We would like to start off with Dr. A.H. Zargar sir. Sir is a former chairman and director of the Department of Endocrinology at Sher Kashmir Institute of Medical Sciences, having multiple publication in index journals to his credit. Welcome to the session, sir.
Thank you.
Next, we have Dr. Satyanath Mukhopadhyay sir. Sir is the professor at the Department of Endocrinology and Metabolism at IPGME and R, Kolkata, India. And sir has multiple publications in index journals to his credit. Welcome to the session, sir.
Thank you, Dr. Shah. Thank you for having me.
Yes. Next, we have Dr. Sadish Kumar Kamalnathan sir. Sir is the professor of endocrinology. Sir, welcome to the show.
Thank you.
And finally, we have Dr. Rimesh Pal sir. He is the assistant professor at the Department of Endocrinology at PGMR, Chandigarh. Welcome to the session, Mr. Rimesh.
Thank you, Dr. Shalin, and good evening to all our viewers.
So we would like to, we've got stalwarts with us this afternoon. So we'll set the ball rolling with some basic questions, and I would like to start off with Dr. Zargar sir. Sir, what are your initial comments as far as vitamin D is concerned? And the audience would like to know what is the importance of bone health and where does vitamin D stand as far as bone health is concerned?
Thank you so much. It's a pleasure connecting with our audience and with our people this evening. Our skeletal system is as important as any other system in the body, and the whole edifice of our body is structured around our skeleton. The main component, the material from which the skeleton is made, calcium, proteins, and lots of other substances. But vitamin D is extremely important to mineralize this, to ensure that it gets a proper amount of calcium deposited into it. So vitamin D, along with the other nutrients, particularly I would talk about calcium, even proteins and other substances are extremely important to ensure we have a quality mass of the bone and adequate mass of the bone. If we have vitamin D deficiency in our younger days, our bones may be a bit twisted. We might have swellings at the ends of the long bones. We might have rib cage which is distorted. And many of these defects, which are easily correctable in the later stages, even if we become aware of them, may not be 100% corrected. One. Second important thing is if the same deficiency sets in later on in life, we have a condition known as osteomalacia, means vitamin D deficiency in adults. It can also lead to a barrage of symptoms, skeletal in origin and extraskeletal in origin. Dr. Shah, fundamental belief would be We need to have an optimal bone health. And I must tell my countrymen that bones are made right from the word go, and bone mass can be accumulated only till the third decade. Like every system in the body, after a particular age, aging sets in. And the same thing happens to our bones. When the bone mass is quantitatively on the lower size, we call it osteoporosis. In every human being, with the process of aging, with the different factors, you start losing this bone mass. So we need to have one optimal bone mass that our genetics dictates at the prime of our youth, and whatever factors are responsible for progressive loss of this bone later in life need to be taken care of. Like, get senile osteoporosis, we get postmenopausal osteoporosis. There are factors that aggravate it, there are factors that slow it down. And vitamin D, as you very aptly said, has a role to play in creating a healthy and good bone right from in utero till any stage of life a human being survives. So there are many things that we are going to discuss in the next hour or 45 minutes. But one uncontroversial role that vitamin D plays is in helping in creating a quality bone mass and ensuring to ensure that this bone mass continues to be qualitatively and quantitatively good for as long as possible. So vitamin D is really important. Dr. Shah.
Yes, sir. Your point is well taken, and you really aptly mentioned that vitamin D is right at the center, and the other minerals revolve around it as far as maintenance and development of bone health is concerned. I'll put my next point forward to Dr. Satyanan Mukhopadhyay, sir. Sir, like I had this patient in the OPD who had come in my OPD with a 25 hydroxy vitamin D level of 11 nanogram per ml today in the OPD, and the patient was really concerned, and he was shocked seeing that report in the bold letters. So how do we go about? So what is the prevalence of vitamin D deficiency in our country, and what are the reasons for the same, and how would we probably counsel this patient or explain this patient about his report, sir?
Well, first of all, let me share a case with you, which was not really an asymptomatic patient presenting to the clinic with a vitamin D level of 11 nanograms per ml. 6 months ago, a patient, 53-year-old lady, multiparous, having given birth to 5 children, was brought to my clinic in a stretcher. She was having pain all over the body and was unable to work. She consulted an orthopedist who took an x ray of the hip because the back pain was the severest, and there were telltale signs of severe vitamin D deficiency and calcium deficiency in the form of a condition we call osteomalacia. After 3 months of supplementation with vitamin D, the patient was able to climb two flights of stairs without any difficulty. It was so gratifying that the patient's relatives thought that I had made some miracle. So here, vitamin D actually masqueraded as a miracle hormone. We talk about certain other miracles in medicine, like treating hypoglycemia with a glucose injection and so on. So here is one example where the effect is so dramatic. But going back to your case, I mean, routine estimation of vitamin D and calcium levels are slowly picking up in this country also, unlike in the past when Dr. Zargar and I started practicing, when we got to see only severe cases of vitamin D deficiency or osteoporosis. They usually presented with, bone deformities and children as severe proximal weakness and a lot of noise, maybe some Durga Puja procession is going on. I don't know at the background. So one of us needs to uh, switch off the audio. It's not coming from my end, I can assure you of that. I'm sitting quite peacefully here. Anyway, so what do you do with a vitamin D level of 11? Well, the consensus is that most people with a vitamin D level above 16 nanograms per mil will be having a normal bone health. Now, having said that, you have to set certain cut points to make clinical diagnoses and go about managing cases. So, any levels below 12 would be taken as an evidence of clear cut vitamin D deficiency, and the patient would be in for a course of treatment. Between 16 and 20, well, technically, this is vitamin D deficiency when you are treating a patient, dealing with a patient across the table. So that's your clinic level vitamin D deficiency. You have to treat. Now, the different question emerges when you think of replenishing an entire population with vitamin D. What do you say to your goal? Do you want the population level vitamin D to go up beyond 20? If you wish to do that, there is a risk that you may induce toxicity in some 2.5% of the population, because we'll shift the entire, the normal distribution bell shaped curve across to the right, and that 97.5% that we talk about all the time of min plus minus 2SD, so 2.5% of the population. And if you talk of a country as huge as India, you think of the number of cases that might end up in having vitamin D toxicity. So it's generally recommended that when you are sitting at the clinic and a patient comes to you with a vitamin D level below 20, you'd like to treat the patient and push the level up to 20, or maybe as endocrinologist we would like the level to be pushed up to 30. Would be comfortable with a level between 30 and 50. But when you talk of the population, you don't try to push up the level to 20 entire population. So a concept emerges which is called the estimated average requirement, which tells us that you target 50% of the population to have a vitamin D level above 20. And if you target that, you will see that you don't need a huge dose of vitamin D to accomplish that, which brings us to the question of fortification, which I think will be addressed by one of us in a minute from now. Thank you. Over to you.
Yes, sir. And sir, yeah. Considering what would be for the general public, what would you say what is the prevalence of vitamin D deficiency in our country? So, people are really concerned regarding the report, so they perhaps need to be made aware that the thing, like, it is not a rare thing, and it is more commoner than they actually think because of more and more screening. So, what is the prevalence of vitamin D deficiency presently in our country?
Oh, actually, that was a question which I was
Yeah.
trying to skirt sort of, because no true prevalence data is available that represents the nation. There has not been any national level study to look at the prevalence of vitamin D deficiency. People have studied prevalence of vitamin D deficiency in say mostly in the southern and northern parts of the country. Recently, some 5 6 years ago, we came up with our own data on vitamin D deficiency in the eastern part of India. The overall, uh, the prevalence figure varies enormously, being as low as 17%, 1/7 reported from down south, to as high as 90% reported from the north. Dr. Varga's data is closer to the upper end. 83% of people in Kashmir Valley are deficient in vitamin D. Now, the deficiency is more common in the northern part of India, which is much further away from the equator, as opposed to the southern part, which is closer to the equator. So more abundance of sunshine. But then if you put a figure like 17 or 18 or 83% or whatever, actually you have to understand the limitations of such studies. Cutoffs are different, populations are different, right? So you change the cutoff and the prevalence changes vastly. So there are those limitations, but overall it's recognized that India is one of the uh, countries where vitamin D deficiency is widely prevalent, despite being situated closer to the equator amidst plenty of sunshine. And there are multiple factors to understand why uh, vitamin D deficiency is so common despite our significant exposure to sunlight. In one word, we Indians are not known as a sun seeking nation. We are a sun fleeing nation. As opposed to that, if you consider the Europeans, they're sun seeking people. And that's why in most of Europe, the prevalence of vitamin D deficiency is low, except in the Scandinavia, people who are at a latitudinal disadvantage, their skin pigmentation actually devolved, making them white so that they can absorb more UVB radiation from the sunshine and synthesize more vitamin D. But vitamin D deficiency is as prevalent in
Yes.
Sweden as it is in India. Over to you.
Right, sir. Your point is well
Uh,
taken. Uh,
Dr. Shah,
we'll,
Dr. Shah, we published some data in 2007.
yes, sir.
Two-thirds of our faculty and residents were having vitamin D less than 20. And literally, hardly any women who had given couple of children had vitamin D more than 20 nanograms. And that is dismal figure for by any stretch of imagination. But in the last decade and a half, I tend to believe that situation is relatively better with the awareness that we try to create in public and medical profession. Dr. Shah.
Absolutely, sir. Point well taken. The awareness is increasing, and hence, probably the exposure and the level of management is also improving. My next point of discussion, probably Dr. Satish Kumar sir would like to take up. Sir, what are the optimal levels of vitamin D for our population, and what are the dietary recommendations to help us reach the same? And what are the suggestions that you would like to give to our general public regarding sunlight exposure as well as the dietary recommendations? So, what is your say on that, sir?
You need to
Satish,
unmute.
yes, sir. You are muted, sir.
Actually, it mutes itself automatically.
You're audible, sir. Now, yeah.
Yeah. Again muted.
Yeah. Now, fine.
So
Yeah, it's okay.
the optimal level would depend upon what is our target. So as regards vitamin D, our target would be primarily the musculoskeletal health. If am I audible?
Yes,
Yeah,
sir.
yeah.
Yes, sir.
Yeah. If musculoskeletal health is our target, then our optimal vitamin D target would be 20 nanograms per ml. As such, if we go towards the extraskeletal benefits of vitamin D, for which there is no specific hard data, we have observational studies quoting for extraskeletal benefits at higher levels, but we don't have any hard data as such at present. So, Endocrine Society advocates cutoff of 30 nanogram per ml for extraskeletal benefits, but there is no hard evidence towards this cutoff. So, yeah, optimal cutoff for musculoskeletal health would be something of 20 nanograms per ml, and for extraskeletal benefits it could go as high as 30 nanograms per ml. And there are some who advocate even higher than that. For specific conditions, there are some who advocate, for example, pregnancy, there are some who advocate as high as 40. So those for extraskeletal benefits, the cutoffs could vary. That's individualized. But for when it comes to musculoskeletal health, the cutoff used is 20 nanograms per ml. To attain this level of 20 nanograms per ml, we are advocated daily vitamin D generation of at least 600 international units per day. That's a recommended daily allowance. That is for the normal adults. If you have adequate sun exposure, this is routinely generated by any normal individual. But if we have restricted sun exposure, then we'll have to depend upon other means. Generally, the main source, nearly 80 to 90% of vitamin D generation occurs through sunlight, and only 10 to 20% is contributed by diet. So as such, we don't really think of diet as a contributor to normalizing vitamin D. So only in the case of either when you are not able to get adequate vitamin D, then we would like to supplement and correct it through supplements. So if at all, if this small amount of contribution through diet can be through something of fatty fish, that's an ideal source of vitamin D. We have cod liver oil, which was a very good source of vitamin D. A tablespoon of cod liver oil was supposed to give the recommended RDA for a day. So it was hence advocated in the olden days and now also. So similarly, we have egg, and a single egg yolk would be contributing to just a 10% of a recommended intake. So maybe on the whole, it may not be contributing to a requirement, but it can help towards the small fraction in our diet which can contribute to vitamin D. And additionally, we also have, in other than fatty fish, we have dairy products like fortified milk, or we have even cheese, butter, and mushrooms, especially sun-baked ones, all contributing to a small degree of vitamin D on its own. I think I had answered whatever was asked for. Is there anything I have missed?
No, sir. Absolutely, your point is you're like spot on, and I think it was like aptly mentioned. Like these dietary, recommendations are important, especially for our country, wherein probably the sunlight exposure that is between 10 a.m. to 3 p.m. That exposure to our population is really limited, considering the average temperature in most of the countries. So your point is well taken regarding the same. My next point of discussion would be to Dr. Rimesh Palsar. And sir, we have seen that vitamin D is being tested in and out. Each and every speciality, right from the specialist to the super specialist, have been ordering vitamin D levels in and out. Are there any specific indicators wherein screening for vitamin D is an absolute must? If so, what are those indications?
Right, sir. That's an extremely pertinent question considering the present scenario. So I would like to take up that question in two halves. As you said, like, are there any specific groups or risk groups where vitamin D measurement is imperative, and whether generalized population screening of vitamin D is necessary. So I will answer the second question first. So whether generalized screening of vitamin D is necessary, the answer is a big no. Generalized screening, population based screening of vitamin D is not warranted, and it is not advocated by any of the recommended, any of the organizations or international recommended organizations. Say it be the Endocrine Society, say it be the American Association of Clinical Endocrinologists. And very recently, I want to mention the guidelines that have been, or the recommendations that have been put forward by the United States Preventive Services Task Force, USPSTF. They are the lead in making such recommendations. They have updated their recommendations from 2014 to 2021. And they have clearly mentioned. I have a small handout. I just want to read out what they have exactly said. They have said that there is no that the evidence is insufficient to assess the balance of benefits and harms of screening for vitamin D deficiency in asymptomatic community dwelling non-pregnant adults. So population based screening of vitamin D levels is totally not warranted. Now I will answer the first half of the question, that is whether there are any specific risk groups where vitamin D levels should be estimated. The answer is a big yes. And the Endocrine Society guidelines that were put forward way back in 2011, unfortunately, they have not been updated. They clearly mention that vitamin D deficiency should be, vitamin D deficiency should be screened in individuals at risk for deficiency, and the level should not be screened on a population basis. So, what are those at-risk individuals? So the at-risk individuals are those whom we suspect of having rickets or osteomalacia, as have already been talked about by our senior panelists. Any patient having osteoporosis, documented osteoporosis prior to starting treatment, just because we need to ensure that vitamin D levels are sufficient prior to commencement of any specific anti-osteoporotic therapy. Certain conditions that affect vitamin D metabolism, like chronic kidney disease, hepatic failure, as well as certain drugs like anticonvulsant medications, glucocorticoids, antifungal medications, highly active antiretroviral therapy, all of which affect rather increase vitamin D metabolism and reduce 25 hydroxy vitamin D levels. Any malabsorption, all malabsorptive states, like something that is very common in the northern part of the country, that is celiac disease, inflammatory bowel disease, cystic fibrosis, and another scenario that is fast cropping up is post pediatric surgery. All this, all these patients suspected of having all these malabsorptive states should also undergo evaluation of serum vitamin D levels, and some other conditions like pregnant and lactating women, obese individuals, because since vitamin D is a fat soluble vitamin, vitamin D tends to get sequestrated in the fat. Hence, obese patients are almost 1.5 to 3-fold higher at a higher risk of having vitamin D deficiency. So obese individuals and older individuals, because of limited mobility, sunlight exposure is all the more limited, and they are more prone to develop vitamin D deficiency. And in certain pathological states like primary hyperparathyroidism, because if there is concurrent vitamin D deficiency, supplementation of vitamin D has been shown to reduce PTH levels without significantly increasing calcium levels, and certain other conditions like hypoparathyroidism, where apart from active vitamin D, one should ensure, the treating physician should ensure that 25 hydroxy vitamin D levels are replete. So apart from this risk groups, or rather this risk cohort, routine screening of vitamin D is not recommended. And one last point I want to add from my personal perspective is that one serum estimation of vitamin D, that is total 25 hydroxy vitamin D, which is done in most of, which is a standard of measurement. So from a standard lab, it would cost around 1,000 to 1,500 rupees, if I'm not wrong. I'm in a government institute, so the patients, have to pay far less. But in a private institution, from private setting, I feel one test would cost around 1,500 rupees. And on, I personally feel that instead of paying 1,000 to 1,500 rupees in getting a test done, the same amount could be used for getting vitamin D supplemented. The entire 8 weeks of supplementation would be complete at a much lower cost. So routine screening is not recommended, but this is a certain risk group where vitamin D levels should be estimated. I would like to, end this question with this comment.
Absolutely, Dr. Rimeshwar. Your point is well taken, and as you rightly said, the bottom line of this question is basically universal screening is not recommended. However, there are specific indications where testing for vitamin D is a must. So it is very important to identify those situations and test for vitamin D. However, generalized screening is not recommended as of now. So your point is well taken. I would like to now again come back to Zarga sir. Sir, as we have seen with the screening part, even as far as treatment and supplementation of vitamin D is concerned, there have been excessive and unsupervised supplementation with the vitamin D, and we've seen many cases of vitamin D toxicity. Perhaps in the last few years, because these vitamin D has been used in and out by everyone. So in such scenarios, how can we identify those patients? How can we diagnose vitamin D toxicity? And what are the manifestations of these unsupervised vitamin D supplementation? May it be oral or injections? Your say on that.
I would first take the liberty of saying a sentence on what Dr. Ramesh said. This unscrupulous generalized screening, I personally believe, is doing more harm than good to people. And I'm not talking about vitamin D alone. You see, Satyanath will tell you, you must have yourself seen, our colleague from Pondicherry will tell you, I'm sure Ramesh in his younger days or must have already seen, every time, suppose now a diabetic or a patient with hypothyroidism or thyroid, we ask 3 tests. Get free T4 done, TSH done, and TPO antibody. You get a thatch of tests which takes hours to get the screen. You want a blood sugar, you want a HbA1c, you want a KFT, you want a lipids. After 6 months, 1 year, you want an ECG. You get 200 tests. 2 things I have observed in my long half a century's practice. One, many times the core issue gets diluted. Now, suppose a person comes to me for diabetes. He is stuck up with a uric acid of 6.7 because it is marked red there. All right. And the other day, like Satyanath was telling you about that lady with osteomalacia and rickets who thought he did wonders by treating her, and she was ambulatory after. Must be a treatment of less than $1,000, which Ramesh said would be better used for treatment. And so yesterday, one lady came who has a diabetes, uncontrolled diabetes, not taking insulin properly. Just is 42 years. I'm bothered about her creatinine of 1.3. She's telling me, sir, मुझे तो rheumatoid है. मैंने कहा C-reactive protein बहुत ज़्यादा आया है. I'm saying, even at this age, I lost my cool. I said, you just are not listening to me here. Why are you coming to me? Go to some hospital. Go to some local. So the point is, Ramesh, this is important. We should insist on people, get tests done that we have asked. Don't come with tests that someone else has given to you. अब वो SGOT PT का वो 45 लेके आसमान चढ़ा देगा, वो diabetes की गोली नहीं खाएगा. So it's extra, and that is happening. The other day, one senior law guy, a senior judge came to me. डॉक्टर साहब, आप ये विटामिन डी मुझे बहुत कम है. आप I saw it was 12 nanograms somewhere. I said, how much did it cost? Ramesh, this whole bunch of 200 tests had cost him 1,500 rupees. I said, this is not tenable for a private sector. You would get these many tests done. I said, I had already written you vitamin D. Why did you get this done? You should have taken the sachet. It would have been up to the mark. So why I know I'm a bit emotional about it is because many times patients get diverted from the principal disorder and get diverted to a non-issue. Now, coming back to overdoing or underdoing, I think, Satyana said it right in the beginning that, if we sort of do it everywhere, we end up in a mess in overdoing. Classical example is we see a lot of malnutrition in our country. So people need to eat well. But we see also obesity. It doesn't mean that we keep on eating that we bloat everywhere. Then we start talking about malnutrition and metabolic bone disease because of progressive obesity. So the key is balance. The same key balance is for vitamin D. The point is somebody needs to ensure where that balance lies. When in a random fashion a vitamin D test is done and Ramesh told you its limitations, then people start taking vitamin D on their own. One, in the olden days, in 80s, we also used to give an injectable vitamin D 6 lakh units to people from villages where we believed they would not come back. And this sachet of 6 lakh units, 60,000 units were not available in the public domain the way they are today, right? So if we give these sachet, then toxicity is extremely unlikely. It's extremely unlikely. You give it for 4 or 5 weeks, even if you give a break of a month or two, even if you again do it. But with those, not only Dr. Shah and our senior guys, colleagues would bear me out. People used to get courses of this injectable vitamin D, not an injection. Take it weekly for 2 months and 3 months. And that is where the disaster sets in. We are shifting from that malnutrition to morbid obesity. And this causes problems. In the last decade or two, we have been seeing these problems. A lot of, but every time, many times, this injectable is responsible, but we have also seen people want to be healthier they are, so they get on their own these tests done, which many times are not, unfortunately, a true reflection of their vitamin D. So they keep on taking this sachet, sometimes every day, for low backache, for degenerative joint disease, for osteoarthritis, for lumbar disc disease, spondylosis, whatever. And these guys are in a big trouble. And the no hypercalcemia symptoms are so sort of non-specific that somebody getting nausea, somebody getting vomiting, somebody getting constipation, somebody getting aches and pains, somebody getting behavioral abnormalities, and somebody getting areas of ectopic calcification. And many times, it would not be pointed to that injection or that sachet which person is regularly taking. And now many times, unfortunately, the non-professionals also do give these sachet now, and these injections in particular. So yes, caution is the word. Only take medicine when see, today there's no dearth of reasonably trained doctors in our country. We may not have excessive doctors, but somewhere in the neighborhood you will always find a doctor from whom you can seek a consultation, that where to draw that line. So yes, deficiency is very common. We need to correct it. It's important for health, but this all deficiency should be corrected under supervision, not on anyone's whims. And there are better physician, and necessarily not every time an endocrinologist everywhere, and our gynec colleagues, our orthopedic colleagues need to make themselves properly aware of the overdosing of this vitamin D and how often to give and how much to give. Dr. Shah.
Absolutely, sir. So, what we're trying to basically say is that we need to strike a balance between, supplementing and over supplementing. And, that is a fine line which, needs to be drawn by the treating physician. My next point of discussion is again aimed towards Dr. Satyanath Mukhopadhyay, sir. Sir, what is the role of food fortification as far as vitamin D supplementation is concerned, and what is the state of vitamin D fortification in our country? What are the steps that the government of India is taking as far as fortification of vitamin D is concerned? What is your say on that, sir?
Before I answer this question, let me take the liberty of taking a minute extra to respond to what Dr. Dimesh and Dr. Zargar just now said about vitamin D supplementation, overdoing, underdoing. Well, if you take a vitamin D preparation which is available over the counter, a calcium tablet with vitamin D, some 400 units to 500 units on a daily basis, no toxicity happens ever. If you go to the US or in most of Europe, you will see vitamin D tablets containing 3000 units per tablet. Single dose is available over the counter. You go to Walmart, you can buy a pack of vitamin D tablets containing 3,000 units each, because this is considered safe. So even if people are taking 1,000 units a day on a daily basis as a supplement, nothing much is going to happen by way of toxicity. So this is absolutely safe. And if clinicians feel that the patients might be having vitamin D deficiency, they may start treating them, like Professor Zargar says, without even bothering to check their vitamin D level, because checking will cost more than treating, right? So go and treat vitamin D deficiency right away. Now, coming back to food fortification, let me share something with you, that when the life evolved in the primordial sea, there was no need for vitamin D deficiency, vitamin D supplementation. Even today, marine life does not depend on vitamin D, because seawater has loads and loads of calcium, and marine animals have evolved systems over more than 500 million years to assimilate those calcium, either directly through their skin or by ingesting the phytoplanktons that are enormously rich source of vitamin D in the seawater. Like you have seen the whales taking gallons of water containing billions of phytoplanktons, so they don't suffer from vitamin D deficiency and from calcium deficiency. They don't need vitamin D. The question of vitamin D deficiency started when terrestrial life forms developed. So mammals, including humans, needed to develop a robust vitamin D system on their skin. The plants needed to develop a robust vitamin D synthesis systems to produce their own vitamin D, which is argocalciferol. Right? It's interesting to note that cats, dogs, and birds, they do not produce any vitamin D in their system on the skin, because in birds' case, it's covered with feathers. So what do? In their non-feathered skin, the rate of vitamin D synthesis is 10 times more than what it is on the human skin. That's one way of making vitamin D on the non-feathered skin. And their second mechanism is they bring up oil on their feathers. You may have seen the pigeons glistening, the peacocks glistening feathers. How does that come about? Oils from underneath come onto the surface of the feather by constant movement of the feathers. Then vitamin D gets synthesized on those oil droplets. And by a mechanism known as preening, which birds are known to do all the time, they pick at their own feathers and they ingest those oil droplets and make themselves vitamin D deplete. So they never ever require vitamin D supplementation. Cats and dogs do not synthesize vitamin D on their furry skin. So they depend exclusively on diets that are inherently rich in vitamin D. Your pet dogs and cats who are kept most of the time, indoors with you and have a diet poor in vitamin D deficiency, so they benefit from dog food and cat food, which are necessarily supplemented with vitamin D. This brings us to the question of vitamin D supplementation for humans. Now, taking a cue from the National Salt Iodization Program, which has been a huge success story as far as India is concerned, and has nearly completely eliminated iodine deficiency disorder in this country. Government of India has, I think 2 years back, 2020, in a Gazette notification, approved fortification of milk and oil with vitamin D. While it is known that vitamin D of animal origin, vitamin D3, is much more potent than vitamin D of plant origin or vitamin D2 to increase your blood level of vitamin D, the government, maybe giving some importance to the vegetarian habit of a large section of the people of the country, have chosen to fortify milk and oil with vitamin D2 and not vitamin D3. Although this notification came back in 2020, nothing much happened since then because we are a slow mover as a nation. So hopefully it will be implemented soon on a large scale. What has been recommended is that for school going children, you give them a 200 milliliter, I think 160 milliliter of milk to drink at the recess time as a part of a national program free of cost. And that milk will give the children 240 international units of vitamin D. Couple this with whatever vitamin D they can get through diet. So this will serve the estimated average requirement for vitamin D for those children, as Dr. Shadish was pointing out. Oil fortification again is a good way to get vitamin D. People have asked questions that in India again we have a habit of deep frying the food, which is not the practice in the West. So what happens to vitamin D content of your oil when you deep fry the food? Well, nothing much happens. Around 10% loss has been reported because vitamin D is an extremely heat stable molecule. So you can fortify oil, you can fortify your milk. But that said, nowadays rich people get their vitamin D by visiting the supermarket. How? You get sun-dried tomato, sun-dried mushroom, 3 times the cost of at which mushrooms and tomatoes are sold in the market, common market for common people like us. So people who visit those swanky super malls, they get vitamin D, fortified tomato, mushroom, and other vegetables, capsicums, and so on. So they get themselves fortified that way. Over to you, Dr. Shah. Dr. Shah, some connectivity issue there. Dr. Shah, can you hear me? Are you back?
Yes.
Okay.
So yes, sir, your point is well taken, and yeah, there have been committees which have been set up to basically establish this fortification universally throughout our country, and some of the top companies like Amul and Mother Dairy, they've come up and they have started fortifying their milk with vitamin D. However, there needs to be more and more which needs to be done, and a lot still is left to be desired. My next point of discussion is directed at Dr. Sadish Kumar sir. Sir, for general public, seeing a person in front of you, what would be the manifestations of vitamin D deficiency may it be an adult versus a child? So how would the common public come to know that, probably the other person standing on the other side has vitamin D deficiency? What would you say to them, sir?
Yeah. This is something pertinent again. In an adult, we should know presentation of vitamin D deficiency is going to depend upon the severity of the deficiency. And if it is something mild or to moderate, then yes, large section can be asymptomatic. I know of, in fact, some people can be asymptomatic even with levels less than 4 nanograms per ml. So, but a majority of the population with deficiency can be asymptomatic. That is a point which we should know. In those symptomatic, it can largely the presentations are mostly musculoskeletal, and it can be to an extent non-specific also. When it comes to musculoskeletal symptoms, it can vary from severe myalgia to bony pains to muscle cramps. Some can have something of tingling or paresthesias. So largely it's more musculoskeletal. When it comes to something of severe vitamin D deficiency, it can take the form of severe muscle ache, going to the extent of neuromuscular neuromuscular dysfunction mimicus. It can take the form of something of paraparesis. Some people can present with, there are multiple cases which we have admitted in our ward, which are transferred from neurology as paraparesis and later found to be just vitamin D deficiency. So in adults, such a presentation is pretty common. And another presentation of severe vitamin D deficiency is something called osteomalacia, wherein there is softening of the bones, which can further lead on to fractures in the elderly or even in younger population. So severe vitamin D deficiency can lead to osteomalacia and thereon to fractures in adults. When it comes to younger children, again, the presentation will be non-specific, but more often when it comes to severe vitamin D deficiency in them, it takes the form of, in the time of growth, it takes the form of rickets with deformities in the limbs, in the lower and the upper limbs. So the severe deficiency is going to present with deformities as rickets, and younger children can present with metabolic abnormalities secondary to severe vitamin D deficiency, with metabolic abnormalities like hypocalcemia, and thereof presentation as hypocalcemia with tetany, and some can go on to present with seizures too. So this is and these children can also have myalgia, but that's not as described as in adults. And other presentations also exist, but and those are not specific to vitamin D deficiency per se. Back to you, Dr. Shah.
Absolutely, sir. I hope our viewers have taken note of all what sir has said, which would go a long way for a general public to perhaps, identify if someone having a vitamin D deficiency. My next question is directed to Dr. Rimesh Pal, sir. We know that, social media is flooded with multiple benefits of vitamin D, right from cancer prevention to treatment of cancer to decreasing, events like heart failure, MI, etc. So, what is your say regarding these extraskeletal benefits of vitamin D? Where do you stand on that aspect?
Okay, that's a very what do I say? A controversial and a very I feel a very difficult question as well. So basically, I would spend maybe a couple of more minutes on this question just to clarify the pros and cons of vitamin D as far as extraskeletal benefits or extraskeletal manifestations are concerned. So basically, why did this at the outset? Why did this association of vitamin D with extracellular manifestations crop up? So this was the main reason was because of the fact that it was observed that the vitamin D receptor, the VDR, and the enzyme that activates vitamin D, that is the 1-alpha hydroxylase, are expressed not only in bones but also in many tissues that are not even involved in calcium and phosphate homeostasis. So this was a what do I say, a trigger that made people think as to whether vitamin D has some extra osseous benefits as well. So this was followed by many observational studies and meta-analysis of observational studies that showed that low vitamin D levels were associated with many diseases in humans, notably, as you said, like malignancies, cardiovascular disease, cardiovascular events, cardiovascular death, respiratory infections, progression of prediabetes to diabetes, and last but not the least, in the present era, COVID-19. So, I must emphasize on the fact that all these data most of the data that were available till date were based on observational studies, and as we all know, observational studies cannot differentiate between association and causation, and association does not imply causation. So for definite causal links to establish, one should have well planned RCTs or something called Mendelian randomization studies. So these Mendelian randomization are a form of genetic epidemiological studies. This is something a bit difficult, and we have never performed such studies, so I won't go much into it. So so if we look into the present scenario, so these observational and meta-analysis of observational studies have been present since decades. That made us think, and made social media flood with so much data of extraskeletal effects of vitamin D. But over the last half a decade, like from 2017 till now, there have been a few well planned and large randomized control trials that have looked into the osseous as well as extra-osseous effects of vitamin D. So, I mean, our viewers might not have to go through it in detail. I will just mention the name of a name of those landmark trials. So, what I can recollect, at least I can recollect 4 landmark trials. One is the Vital trial, the Vida trial, the D2D trial, and the Do Health trials. All are extremely landmark trials. And if we put together all these 4 trials, we would have nearly more than 35,000 participants. So that's a huge number. So unfortunately, all these trials had been performed on a predominantly vitamin D replete population. The prevalence of vitamin D deficiency in this group was hardly 10 to 20%. So, and these trials did not find any benefit of vitamin D supplementation on any extraskeletal benefits like cancer, cardiovascular events, progression to type 2 diabetes, falls, or even fractures. So this is something. So a sub-hoc analysis of the Vital trial was published, I think, probably a fortnight back in NEJM, and they didn't even find a benefit of vitamin D supplementation in fractures. So we will leave aside extraskeletal effects. We are talking about skeletal effects, and even vitamin D didn't prove to be a game changer as far as skeletal effects are concerned. But I must again say that the population that these studies included were vitamin D replete. So when this data was reanalyzed and a subgroup or post-hoc analysis was performed on patients, or rather on participants who had vitamin D deficiency at baseline, the authors did find some benefit, some degree of benefit. But by some I mean the effect size was not big. The effect size was small. They did find some benefit in terms of reduced progression to type 2 diabetes from the D2D study, decreased number of respiratory infections, decreased cancer, and overall mortality. But I must again say that this data was based on subgroup analysis of a trial where most of the patients were vitamin D replete. So I will just conclude by saying that while vitamin D supplementation may have some extraskeletal benefits in patients who are vitamin D deficient, again based on a limited number of participants, based on subgroup analysis, the vitamin D definitely has no extraskeletal benefits as far as vitamin D replete individuals are concerned. So to conclude, I will just say that vitamin D. So I will beg to differ slightly from Satish Kumar sir. So I personally feel that for extraskeletal benefits, probably there are no such cutoffs. So vitamin D deficiency should be corrected at any age, irrespective of adult, irrespective of children. However, as of today, the evidence we have, one should not expect any extraskeletal benefits out of vitamin D deficiency. So the Endocrine Society guidelines in 2011, which has not been updated, they state that extraskeletal benefits in the form of fall, like vitamin D supplementation provides extraskeletal benefits only in the form of falls, and no other extraskeletal benefits have. Even in 2011, they did not report any other extraskeletal benefits. Now, the present data also suggests that even vitamin D does not protect against falls. So vitamin D deficiency should be corrected, but from the osseous point of view, not from the extra-osseous point of view, as far as the present data is concerned. But I find it very striking as to why large-scale trials are being conducted in a vitamin D replete population. I find it very absurd, actually. We should, if we are talking about a hormone which we have to supplement in a deficient state, we need to conduct more trials in that target population who are vitamin D deficient.
Absolutely, Dr. Miss. So
I'm not sure how much I've been able to clarify, but
you've been able to clear out most things, all the things. So your point is well taken. We actually require well-designed, randomized controlled trials to basically prove any benefits of vitamin D as far as extracellular effects are concerned, because as you said, whatever studies may they be landmark studies, they've had their own flaws, and there have been many limitations. As you said, that there have been, majority of the patients are vitamin D replete. So the stage is similar to the triglyceride trials, wherein giving those drugs to patients who've got probably a normal triglycerides, you obviously won't see benefits. This is the same stands true for vitamin D too. I think this has been a really good discussion. We're willing to take up some questions from the public, and I think we've had some questions. I hope our panelists don't mind answering some of the questions that have been put up by the public. I'll take up those questions which we've not discussed, considering the time limitations. The first question, sir, I would, Zagar sir, what the question says that in those patients who are on phenytoin and in those who have liver disease, any precautions in case there is poor bone health, that, do the patients need to take specific precautions when they are on anti-epileptics like phenytoin and perhaps with liver disease as far as bone health is concerned?
You see, this question was basically already answered. One, when you're looking at vitamin D supplementation, one thing is that where only vitamin D nutrient is deficient. Second situation is where you either have a pathological process or a drug that has the potential of interfering with the metabolism of vitamin D. So when that disease is being treated by a clinician, he would make an assessment from time to time at what stage a person would need additional supplementation beyond what Satyanath said, around 600 units per day or even up to 1,000 units would not cause any toxicity. But in a person who has a liver disorder, where the first hydroxylation would be defective, or in phenytoin, which induces certain hepatic enzymes, increases the metabolism of certain substances. Yes, this is a very specific question, and specific answer is they would need vitamin D intermittently. But the clinician who is either treating the seizure disorder or some other disorder with phenytoin, or the doctor, a gastroenterologist or a physician who is treating the liver disease, has to make that decision, not because we say it and the fellow takes the drugs or vitamin D. I hope that answers the question, Satish.
Absolutely, sir. Perhaps Dr. Satyanath sir would like to take up the next question. So, sir, the question here is that has there been some research which has been done as far as post-pregnancy osteoporosis and the pre-pregnancy vitamin D levels are concerned? Is there any data regarding the same, sir?
Well, bone loss following pregnancy and lactation is common, but in a healthy nursing mother, the loss is made up within a time frame of, say, a year or 2 years, so to say. So healthy mothers really do not suffer permanent bone loss unless they have to go through multiple pregnancies, and they have adequate exposure to sunlight, and they eat a healthy diet. But of course, there have been studies looking at bone loss following pregnancy and bone loss during lactation. And those studies have documented uh, not even body ache, muscle weakness, but also fractures happening following childbirth and during lactation. But those mothers have been vitamin D and calcium deficient to start with, like Dr. Rimesh had already pointed out. So they are at risk population. They are one of the at risk populations. So if the pregnancy is planned beforehand, one should try and make sure that the mother is calcium and vitamin D replete, even before she contemplates or wishes for a baby or contemplates a pregnancy. And one more important thing is that the mother is not excessively obese. Again, alluding to what Dr. Rimesh has already pointed out, in your fat tissue, vitamin D gets stored and or sequestered is the technical term. So making less vitamin D available in the circulation. to benefit the system as a whole, or the person as a whole. So cut down on obesity, make yourself calcium and vitamin D replete. This is a message to prospective mothers. I think I should stop there. Thank
Yes,
you.
point well taken, sir. Dr. Sadish Kumar, sir, this one is directed to you. We would like a quick view on this, whether Indian generic brands are all equivalent to the available pharma innovators as far as vitamin D supplementation is concerned.
Difficult.
I don't have experience with all the brands. Among the brands which specifically I have used, I don't find anything grossly underperforming. I can't vouch for all the brands, but among the few brands I have used, I have found they were effective. So I can't vouch for all the brands whatever are there. What the brands which I have used, they had been
Dr.
effective.
Shah, time permitting, may I have a quick comment on this?
Sure, sir.
Actually, Dr. Rajesh Khatgawar's group from AIMS New Delhi, they have published their data on bioavailability of commercially available vitamin D preparations in the market. And in that study, it was found that only 28% of the vitamin D preparations available in the market, they meet the requirement. I mean, they tell that this much is available in a sachet, 60, and 60 is actually available, or they say 400 IU is available in a tablet and 400 is actually available, give or take 10% plus minus. So rest around 70% of the preparations had vitamin D levels varying between -20 to plus 65% of what is written on the strip
Right.
or the box. So if someone takes that kind of a preparation and has deficiency may not be corrected, or taking a dose which is plus 65% of what is written printed on the label or the bottle or packet, may end up in vitamin D toxicity. So India is a free for all country. No regulation seems to be operating anywhere. So that's the problem. So one has to, I think, stick to brands that are well known, companies that are known for their R&D and who are supposed to maintain standards.
Yeah.
Thank you.
Absolutely, sir. That's a very
That's a
pertinent
huge thing,
information.
Satyana. 20% to additional 60%. Oh my God. That's
Yeah.
a huge thing.
Yes.
Not that plus minus 10, 20.
Yeah.
Really big info. Yes, Dr. Shah.
Yeah. So we've time for just a last quick answer. So this question is to Dr. Rimeshpal. This is a very universal question. How do we monitor, perhaps someone who's on vitamin D supplementation, how frequently to monitor the levels of 25 hydroxy vitamin D?
If you ask me, in my clinical practice, if the patient says, if the patient is, I simply ask the patient, are you taking vitamin D at the prescribed dose? I mean, if he says so, then definitely, there is no point for repeating a serum vitamin D. But yet again, if you consider those high risk groups like rickets, osteomalacia, patient on treatment for osteoporosis, we need to at least regularly monitor vitamin D levels so as to ensure the vitamin D levels are above that cutoff of 20 or more than 30. Maybe, after initiation of treatment, say in a patient with osteoporosis, we are initiating treatment with anti-osteoporotic drugs. We repeat a vitamin D after 3 months, make sure it is more than 30. And if it is more than 30, we again repeat it every 6 monthly. So as to ensure that it is more than 30. But a patient requiring vitamin D, as our senior panelist said, a patient comes to us suspected of having vitamin D deficiency with no other symptoms. We have started him or her on vitamin D. There is no point in repeating a vitamin D levels. In such scenario, that would be my approach towards such patients.
Absolutely, absolutely. Your point is well taken. It needs to be monitored again in the select population over a period of time. That is the key take-home message as far as monitoring is concerned. So I think we are done with most of the pertinent questions that were not discussed earlier on. I think this was a very fruitful and productive discussion as far as vitamin D deficiency is concerned. I think we've covered majority of the points which is absolutely pertinent for the general public to know about, have been discussed in one manner or the another. So I hand out a big thank you to all our panelists for taking the time out on Saturday evening between their OPDs and connecting with us on this Facebook Live session. It has been great interacting with you, and I hope the public which is been through us in this FB Live session have taken away very important points that have been discussed in this meeting. So a big thank you to all our esteemed panelists.
Thank you.
Thank you, everyone, and
Thank
a
you.
special thanks to the viewers.
Absolutely.
connecting
They
with
Thanks
make
for
it
joining.
relevant.
Thank you.
Every
Thank
effort
you.
is relevant when somebody is benefited. Thank you so much. God bless you. Take care. Bye-bye.
Thank
And have a
Thank you.
wonderful
Bye-bye.
weekend. Panelists
Thank
as
you
well
all.
as the listeners.